Good afternoon, everyone. Welcome to the Multi-Ministerial Task Force press conference. On our panel today, we have Minister Gan Kim Yong, Minister Lawrence Wong, Minister Ong Ye Kung, who is dialing in virtually, and Director for Medical Services, Professor Kenneth Mak. May I now invite the ministers to begin with a few words, please.
Thank you. Good afternoon. Since the MTF conference last week, we have seen a doubling of the number of daily cases, with 450 new cases reported yesterday. While we expected an increase in the number of cases every day when we open up, the sharp rate of increase is worrying. Although our vaccination rate has now surpassed that of many countries and is one of the highest in the world, we want to be sure that the number of cases do not suddenly spike, which can lead to more serious cases and which will in turn overwhelm our healthcare system. We have seen how, despite high vaccination coverage, countries like Israel and UK saw a sharp spike in cases after they relaxed their measures. Therefore, we want to be cautious and give ourselves more time to be certain that the high number of daily cases will not result in high number of serious cases or deaths. The next 2 to 4 weeks is therefore crucial, as we will find out if patients eventually develop serious illnesses and complications subsequently. That said, there continues to be strong evidence that vaccination can protect against serious illness. There is also evidence that shows vaccinated COVID-19 cases recover faster than unvaccinated cases. We have seen this globally and also in Singapore. Of all the cases we have seen in Singapore so far, less than 0.1% are admitted to ICU or passed away. Bearing in mind the protection that vaccination provides, we will continue to push for higher vaccine coverage amongst those who have yet to do so and speed up the rollout of booster shots for those who are eligible. As of 9th of September, 81% of our population has received 2 doses of COVID-19 vaccines. And for those who have loved ones who are not vaccinated yet, please reach out to them and encourage them to get vaccinated. For those who are eligible for a booster shot, please do so when you receive your notification. We understand that the rapid increase in infection numbers have created some concern and anxiety among our people. Therefore, we announced some measures earlier this week to attempt to slow down the increase and prevent our healthcare capacity from being overwhelmed. Since then, there have also been questions on whether government is going back on our plan to reopen despite our high vaccination rates. While I understand that many would prefer a straighter road to COVID-19 resilience, we have said before that we must expect some twists and turns along the way, given the unpredictability of the virus. So we need to be prepared to adjust our plans as we go along. Singapore has done well so far. We have one of the highest vaccination coverage in the world, with one of the lowest death rates. This is almost unseen globally and the result of the trust between the people and the government. As we enter more uncharted waters in the coming days, we will need to step up testing, as we announced earlier, and make it a key part of our strategy in our journey towards COVID resilience. Testing will help us detect cases early and minimize the risk of further transmissions. This is especially important to avoid spikes in number of cases. This is also important for businesses, as infections that are caught early are less likely to see large clusters, which will in turn create severe disruptions to businesses' operations. We will also expand the home recovery pilot to allow more vaccinated COVID-19 cases to recover at home and reduce the quarantine period from 14 days to 10 days. Minister Ong will elaborate on this, on the details later. I would like to thank everyone for your support that you have given us. We are aware that many of you are watching the situation closely. While some would like a quicker reopening of our society and community, there are others who are also concerned about the impact of the rising number of cases and the impact on the public health situation. We take the views of both groups seriously as we take the necessary steps towards building a COVID-resilient state. We are therefore using the next few weeks to give us time to monitor the number of serious cases, ramp up our testing capacity, and continue to increase our vaccination coverage. This will allow us to move forward with more confidence in time to come. I want to thank you, and I will now invite DMS to talk about the Delta variants as well as give an update on the situation.
Thank you very much, Minister. As of the 9th of September 2021, 664 cases were warded in our hospitals, of which 26 cases of serious illness required oxygen supplementation in our general wards, and 7 patients were in critical condition in our ICUs. Over the last 28 days, amongst the infected cases, the percentage of the unvaccinated who became severely ill or died was 5.2%, while that of fully vaccinated was 0.8%. And this means that if you are still not fully vaccinated against the COVID-19 virus, you will have more than 6 times, in fact, it's 6.5 times a higher likelihood of getting a severe infection and a bad outcome compared to a fully vaccinated person. The number of new cases reported daily has risen very quickly over the last 2 weeks. Yesterday, the Ministry of Health announced a total of 450 new local cases of COVID-19 infection in Singapore. This is in contrast to 216 new local cases reported 1 week earlier on the 3rd of September and 120 new local cases the week earlier on the 27th of August. This doubling of new local cases weekly reflects an ongoing community spread of COVID-19 that has taken place as we lightened the community restrictions after our phase 2 heightened alert phase, and has allowed more social interactions then to take place. In our epidemiological investigations, we have identified transmission occurring in workplace, social, and household settings, contributing to the large clusters that we had to then deal with in the Bugis shopping mall, at bus interchanges, and at other work sites. These transmissions may have been facilitated by the increase in mask-off, close physical interactions occurring between individuals and amongst groups of people. There were also breaches in safe management measures and poor compliance in mask-wearing requirements in some of these cases that possibly further contributed to spread. The phylogenetic tests that were successfully performed on the cases to date have shown the Delta variant to be currently the dominant COVID-19 virus causing infections in our community. Compared to the wild type or other variants that we encountered last year, the Delta variant has caused a different clinical and epidemiological pattern to the COVID-19 infections that we encountered now. And this is driving the present rapid rise in infections. So what do we know about the Delta virus variant as it applies to us? First, the Delta virus is highly infectious and transmissible compared to other virus variants that we have encountered in the last 20 months. We've seen a number of super spreading events arise this year related just to the Delta variant, with multiple generations of spread across different geographic settings. This includes the Jurong Fisheries Port cluster, with further spread taking place through fishmongers and other stall holders and operators who shuttle back and forth between the port and wet markets across the island. Beyond these fish stall operators, further spread had taken place to other stall operators and the market, and even cleaners, patrons to the affected stalls, and then subsequently to household members. Our National Center for Infectious Diseases, or NCID, has demonstrated that infected people with the Delta variant may have high viral loads at an early phase of their infection, and this is particularly for unvaccinated but infected cases, and they have more prolonged shedding of the virus compared to other variants. And this does contribute to the overall increased transmissibility seen with this variant. Patients who are symptomatic from COVID-19 infection have had their symptoms manifest over a variety of different durations of incubation period, from the time of exposure to the time in which they manifest their symptoms. And this can take up to 14 days. However, compared to last year, with the wild-type variants that we encountered then, we've seen more people presenting this year with shorter incubation periods, with a mean of 4 days or less, compared to a mean of 6 to 8 days previously. And this means it takes a shorter time for people to develop the infection and to be infectious, even before they become symptomatic. The shorter incubation period leads to a greater risk of amplification and dispersion of infection if infected people continue with their social and work activities, particularly if it's working away from home. It is therefore not surprising to see large clusters of cases then detected at the onset when we pick up an initial case of COVID-19 in the community. The larger dispersion makes it more challenging to manage and control clusters. And with a rising number of cases and clusters in the community, it becomes even more important for us to adjust our contact tracing, testing, and isolation strategies to try and limit further spread. Firstly, more frequent testing is needed, with tests that have a short turnaround time for results to be acted upon quickly. And this should be done at the workplace and within households as soon as infected cases are detected. We have distributed nationally ART test kits to facilitate more widespread testing, and individuals who are detected to have positive ART test results should seek medical attention, self-isolate as soon as possible, so that we can perform confirmatory PCR tests for COVID-19 and then follow up accordingly. Workplaces are encouraged to implement regular routine testing, and a high testing culture will help us to detect cases as early as possible before too much spread has occurred in that workplace. The Delta variant also causes more severe infection. In many countries, including the UK and in Israel, Delta infections have been shown to be more than twice associated with the risk of hospital admissions compared to infections by other variants. Our local study conducted by NCID has confirmed that patients with Delta infection have a higher risk requirement of oxygen support, ICU admission, and even death. The overall case fatality rate per 100,000 cases in the first 8 months of this year with Delta infections was 27.61. And this was nearly 7 times higher than the corresponding case fatality rate observed in the entire duration of last year, 2020. Vaccination against COVID-19 still makes a difference. NCID has shown in a study of households exposed to an infected household member in the Bukit Merah outbreak that vaccinated individuals have nearly a 2 times reduction in their risk of getting infected compared to unvaccinated people, despite being exposed to the same infected person. The risk of needing oxygen support and of needing ICU stay is also much lower if you are fully vaccinated. And while about 0.1% of vaccinated but infected persons need ICU care, the proportion of unvaccinated but infected persons needing similar ICU care is about 10 times higher. And there's also close to a 16 times lower probability of death if you are vaccinated. So for those of you who are vaccinated and say you're aged between 60 to 69 years, your risk profile has changed with vaccination. Your need for oxygen supplementation or ICU care is now lowered to be similar to that for unvaccinated people less than 50 years of age. Studies in other countries like the UK have shown similar findings of a protective benefit with vaccination for seniors. Our increase in community cases has not been associated with a corresponding increase in the numbers of people needing both oxygen support or ICU care. And notwithstanding the doubling of cases that we are now seeing every 7 days or so, the number of cases in the ICU remains relatively low. And the cases have been predominantly frail seniors with chronic medical conditions and unvaccinated people. This is an encouraging trend, even though we do not wish to see any person coming into the ICU for critical care. And we need to monitor the situation closely for the next 2 to 3 weeks to see if this trend between seeing high numbers, yet with low numbers of people requiring ICU care, continues. And to see if our local experience matches that seen earlier in the UK, where a big rise in their total number of infections following the removal of community restrictions in what they call a Freedom Day, they didn't see any correspondingly large spike in the number of ICU cases or the number of deaths. And we hope that our local experience will be similar. Nonetheless, it will be prudent for us to exercise caution. Now is not the time to celebrate our own version of a Freedom Day. And particularly, if you're vulnerable to severe infections or bad outcome, or if you live with a family member who is vulnerable, please exercise caution and cut down on your social activities or at-risk activities that can lend itself to further spread of infection in the community. And we must be considerate so as not to introduce infection to others. This call not to be complacent is important because we need to ensure that we always have sufficient resources to treat those who are severely infected and who have a need for the limited and precious resources we have in our hospitals. We have done our bit to try and ensure that our resources step up so that we have sufficient for the needs that we have at hand. And in tandem with the rise in community numbers that we've seen, we've taken precautionary measures instructing our hospitals to carry out preparation to bring some of the reserve beds that they had now to be on standby in case we really do need those additional ICU beds. We have also instructed all our hospitals to defer non-urgent elective clinical services in anticipation for a possible further surge in number of patients requiring hospital-based care. And we ask for the public's cooperation and understanding if, as a result of these changes that we have had to make in preparation, it leads to some delays or prolonged waiting time for some of the clinical services and treatments to be given for those who do not have urgent medical conditions. Vaccination reduces the likelihood of infected people transmitting infection. And although the viral load is similar among infected, vaccinated, and unvaccinated people in their early phase of infection, there is a faster clearance of virus among vaccinated patients compared to those who are not vaccinated. And this means that a vaccinated but infected symptomatic person will not be infectious after 9 days compared to an unvaccinated symptomatic person who may take up to 16 days before he clears his viral load. Our clinician scientists have also not been able to culture the virus at that time when the PCR test CT values are well above 25. This has allowed us an opportunity to review our clinical protocols on treating and discharging of COVID-19 cases to either our CCFs or to our new home recovery program. And Minister Ong will share a bit more in a while on some of these details on how these changes have been made. For Delta, we do see more kids infected, but so far we have been fortunate not to see severely ill children. They have either been asymptomatic or with mild symptoms. And we're happy to see this outcome, but we are mindful that in other countries, particularly reported in the US, there have been many children admitted into ICUs and also deaths among children. So while we see our community cases rise, we do need to prepare for every possibility, and that includes that we will see very sick children with infections or even have to prepare for that scenario where we might even see deaths. Our work to increase vaccination coverage must continue, as it remains nearly 900,000 seniors who have yet to get vaccinated. But we are also concerned about other groups of people whom studies have shown have a higher risk of poor outcomes if they get infected. And these are a cause for our concern and we will focus on trying to get as many of them vaccinated as is possible. This includes pregnant women and women who are intending to have children very soon. The chapter of obstetricians and gynecologists in the Academy of Medicine, as well as the Obstetrical and Gynecological Society of Singapore, have issued expert statements affirming that the benefits of vaccination exist, and they far outweigh any potential risks associated with vaccination, and certainly the risk of getting a bad outcome with infection. So women who are pregnant or are planning a pregnancy soon should still get vaccinated as soon as is possible. And if you are concerned about your individual situation, I would encourage you to see your doctor to get further information and advice concerning vaccination. I'll now hand the time over to Mr. Ong, who will share further about our healthcare strategies to support our transition to becoming a COVID-resilient nation.
He's muted. You need to unmute him, yeah.
Sorry. Thank you, Kenneth, for the useful explanation. When the MTF presented our transition plan to a COVID-resilient nation, we explained that let's be prepared to see infection numbers rise and also ICU cases and deaths going up. So the rapid rise in infections over the past 18 days is therefore not unexpected, except it is happening sooner than what we had anticipated. We had hoped for a more controlled preparatory phase, and that's why we came up with that phase, where we can get more people vaccinated, adjust our healthcare protocols, try out several pilot projects to open up social economic activities, travel, while keeping infection numbers at a manageable level, maybe 100, 200. And then we will enter the transition phases where we open up further and expect cases to start rising along a steeper curve. But by then, we would be well prepared to manage it. Unfortunately, Delta variant never followed our plans, which is also not surprising. So this rapid and exponential rise in daily infections that we are experiencing now is what every country that seeks to live with COVID-19 has to go through at some point. But we always wanted to go through it differently from other countries in two major ways. The first is that we want as few deaths as possible. Practically every country that has gone through this kind of transmission wave has suffered hospital collapses and high death tolls. We want to avoid that. If we can achieve that objective, then we will also achieve our second objective, to go through this experience in a different way, which is to avoid a long, hard lockdown, a repeat circuit breaker. And that is, in fact, what New South Wales in Australia and Vietnam are going through now. So the key to go through this experience differently from other countries, as few deaths as possible without a prolonged hard lockdown, the key is vaccination. As DMS explained, vaccines are very effective in protecting us against severe illnesses, ICU cases, and deaths. So are we achieving the two objectives we set for ourselves currently? We take stock. Our cases started rising sharply 18 days ago on the 23rd of August when we hit almost 100 cases, 94 to be exact. And from then, 24th August onwards, it's been rising at a very steep curve, along a very steep curve. Through the 18 days, ICU numbers were kept at 5 to 7 so far. There were 2 new ICU admissions and 1 death due to recent cluster over that 18 days. The MTF will be distributing a chart to illustrate this. So we are seeing high number of infection cases, but so far for 18 days, ICU numbers, admissions, and death has been kept low. But we should expect it to rise. Therefore, there is strong evidence to show that vaccination has weakened the relationship between number of infections and number of patients with severe illnesses and deaths. But it is early days yet, and there is always a time lag between infections and the onset of severe illnesses. As far as possible, we don't want to reverse course in our transition plan. We need to monitor the incidences of severe illnesses and deaths closely in the coming 2, 3, 4 weeks, as Kenneth has mentioned. So let us navigate this wave first before we embark on further steps to reopen. So for now, we are not reversing. We still want to progress on our transition journey, but we are not racing ahead. We are actively responding, watching, and monitoring. If I just repeat this in a few Chinese words, is 冷静观察, 稳住阵脚, 沉着应对. The imperative now is to quickly adjust our healthcare protocols. And that is a very, very urgent task because we are no longer dealing with 50, 100 cases a day, but multiple times of that. The old ways do not work anymore. So what number of infections are we potentially dealing with? Based on the experiences of other countries, mainly in Europe, which are also highly vaccinated, a transmission wave, we know, does not last forever. It typically takes, if you're lucky, 4 weeks, if not 8 weeks. So 30, 40 days, we can assume that, to peak before it comes down and then stabilize. So during that rise of 4 to 8 weeks, daily cases can double every 10 days. And I think we've been seeing that, which means be prepared for 4 to 5 doubling cycles. So we are 18 days into the wave, as I mentioned earlier, starting 23rd of August, and it has doubled twice, and it's on its way to the third doubling cycle, which is why we saw 100 on 23rd of August, and 3rd September, it became 200, and then it crosses 400, and now it is in the process of doubling from 400 to 800. And beyond that, if we think about in terms of 5 doubling cycles, there's 2 more to go, meaning daily cases may double, then from 800 to 1,006, and then 1,006 to 3,002, hitting a peak before starting to come down and stabilize. So what I have just said is what is possible, having observed what happens in other countries. How it actually unfolds will of course depend on what we do collectively, whether we will test extensively with the help of employers, reduce our interactions where possible, wear our mask properly and diligently, get ourselves tested when required, isolate ourselves when we are ill or when we are tested positive through ART. And if we can do that, maybe we can avoid 5 doubling cycles. Maybe we can get away with 3, 4 before we settle down. Let me just cite what are the numbers in other countries having settled down and then living life quite normally. Yeah. I just came back from Europe from a G20 meeting. I can see many European countries are living life quite normally. So if you look at South Korea, life is quite normal there. If we look at the infection rate, and here let's measure it by number of infections per 100,000 population per day. Yeah, so it's a rate comparable across different geographies. South Korea is about 3 to 4 and living life quite normally. Italy, Denmark, Sweden, 9 to 10. 9 to 10 infections per 100,000 population per day. Germany is about 11, Netherlands about 15, France is about 18, Switzerland is at 30, USA is at 45, UK is 55 or so. We are currently 7, so at the lower end of all these countries that have been living with COVID, but rising, and it may surpass many, peak before it comes down. But that is how other countries have dealt with it, going through a wave in order to live with COVID. The key is, as we go through this wave, a key imperative is to get our healthcare protocols readjusted, in fact, reconfigured. And you need to shift decisively to cope with a much larger number of infections. Based on the characteristics of Delta variant, which DMS has presented, we will make the following 4 major changes. First is quarantine. At these numbers, our contact tracers can no longer interview every infected individual, map out their whereabouts and contacts and try to link them and try to form clusters. Each interview takes about 2 hours. When we are 100 cases, they can interview everyone. At these numbers, it's not possible. So instead, we will focus our resources to deal with vulnerable settings and large clusters, such as hospitals, schools, nursing homes, should they be infected. We will also rely on simpler, scalable methods, such as automatically quarantining household members of the infected and then make them serve home quarantine. We will also generate a list of close contacts using Trace Together data. So for very close contacts, we will send out health risk warnings so that they will get themselves, they are required by law to get themselves tested and self-isolated until they receive a negative result. For contacts that are not as close, we may send health risk alerts for them to just monitor their own health closely. That's the first change. Second change, as the incubation period for Delta is shorter, as explained by DMS, with a median of under 4 days, we will shorten the quarantine period from 14 days now to 10 days. This will be less disruptive to people and yet capture a significant majority of infected cases. Third, based on the finding that infected individuals with CT above 25 are no longer infectious during the recovery phase, we can also bring forward discharge. Today, an individual is discharged on day 10 if he's tested negative or CT above 30. We will now allow discharge for day 7 if he is tested negative or CT above 25. If not, he will be discharged at day 10. We will continue to review the data and tweak the discharge policy accordingly. Fourth, we will move decisively on home recovery. This is very important so that hospital beds are allocated to those who truly need medical attention. And it's important, very important to do this when case numbers rise. Today, the large majority of infected patients are in hospital more for observation, and most are discharged uneventfully. So we started a home recovery pilot project for 21 individuals, with 9 already discharged. It has worked well. The individuals are relieved. They can recover from home, and their neighbors has been very supportive, very understanding. I really thank them for that. We would have wished for more time to expand the pilot before making a bigger move, but we have no time to do that. We will implement in the next few days a default home recovery for 2 groups, or rather for 1 group of individuals, and strongly encourage home recovery for another group of individuals. So for the first group, default, and these will apply to those who are young, fully vaccinated, who do not have underlying illnesses or comorbidities. They must not live with any vulnerable persons, such as pregnant, immunocompromised, or anyone above 80 years old. Their homes must have a room with an ensuite toilet. We will start with younger persons and then gradually raise it to individuals who are about 50 years old. And this will account for about 50% of infected cases now. Second, strongly encourage are for infected children between 5 to 11 years old. Many parents have in fact been requesting for them to recover and to be cared for at home, especially when the children they can see are generally well with no or very minimal symptoms. But our hospitals have been cautious and have been admitting these children to the ward. So we will change this policy and encourage parents to bring children infected with COVID-19 home for recovery. At the same time, we will ramp up our community care facilities, isolation beds, and ICU beds. With all these changes, we can handle about 1,000 infections a day. And we have drawer plans to make further changes to the protocols and ramp up more facilities to handle beyond 1,000 cases a day, which we are likely to, I think. I should point out that the protocols I just described are similar to those practiced in US, UK, Europe, and also Japan. Their starting point is influenza protocols. Our starting point is SARS protocols. But in terms of severity and transmissibility, COVID-19 is somewhere between SARS and influenza. And so we find our practices converging over time as we learn about dealing with COVID-19. Now, boosters and vaccinations. While we have a very high vaccination coverage, we will continue to administer vaccines. Our mobile and home vaccination teams, including many volunteer nurses and doctors, continue to work hard to get our vulnerable seniors vaccinated. We have announced the start of a booster program. Our specialist outpatient centers will offer booster vaccinations to fully vaccinated immunocompromised persons from 15 September 2021. In addition, there are about 900,000 seniors aged 60 and above eligible for booster shots. From 14 September 2021, we will be sending out some 200,000 SMSs to those who took their second shots in March this year or earlier to make an appointment for their booster shots. And the booster shots can either be Pfizer or Moderna vaccines, as recommended by the EC19V. MOH recommends that you take the shots, so please come forward when you receive the SMSs. We will also begin administering the third shots to seniors aged 60 and above in nursing homes around the same time. Sinovac. About 1.5% of our population has taken the Sinovac vaccine, administered through the SAR route by private clinics. MOH has also administered the Sinovac vaccine to those who are allergic to the mRNA vaccine. The private clinics had suspended vaccination as their stock has been depleted. MOH has facilitated the ordering of new stock. Barring unforeseen circumstances, they should arrive around 20th of September and be available at some of these clinics a few days after that. In conclusion, I mentioned earlier that to live with COVID-19, no country is spared from going through a wave of transmission like what we are experiencing now. But we have done whatever we can to prepare for this. Circuit breaker, heightened alert, implement trace together, safe management measures, and very importantly, vaccinating the large majority of our population. I consulted widely with my colleagues before preparing these talking points. And after hearing from them, and they asked, since I have the microphone here, they asked whether I can help them convey the following advice to the following groups. Seniors, if you are a senior, during this period, minimize your social interactions for the next 1 month. Just go out for essentials, like buy food or see the doctor. This is especially if you are still unvaccinated. And if you pull down your mask to below your nose and chat with your friends for an hour, you put yourself at a very high risk of infection, and consider getting yourself vaccinated. If you are a young person and you live with seniors who may be your parents or grandparents, please help to protect them. Also minimize your social interactions, cut back on eating out or bringing many friends to your home, because these activities can easily bring the virus to the seniors living at home. If you are pregnant, please understand that the scientific data internationally is very clear that vaccines are safe for you and your baby, but a COVID-19 infection is not safe for you and your baby. So please get yourself vaccinated. And if you are someone who are somehow still not vaccinated or have been persuading your parents, grandparents, or pregnant wife not to get vaccinated, it is perhaps time to reconsider. The risk between vaccinating and not vaccinating has significantly shifted. More than ever, we need to work together, exercise civic consciousness and personal responsibility, and do our part. Take care of ourselves and take care of everyone around us. Thank you.
Good afternoon. Much has been said just now by my colleagues and DMS, so let me give a quick summary of where we stand today. We have a plan to reopen and live with the virus, and we knew all along, and we've said so before, that once we reopen and resume activities, we will experience a new wave of infection. All countries that open up have had to deal with such waves. For us, it is happening faster than we had expected. And it's also the first time since our opening that we are facing such a new exponential wave of infection in our community. Very soon we will reach 1,000 new cases a day, and in a few weeks' time we will probably get to 2,000 new cases a day. And that's why we have to take a more cautious approach in the current situation and make sure that we adjust quickly to this fluid and rapidly changing infection situation. The difference between now and what we had, say, a few months ago or even last year is that we have a much higher vaccination rate and so better protection from the vaccines. And that's why we've said before that our focus is not just on the daily infection numbers, but the number of serious cases needing oxygen and ICU care. And indeed, that's our key focus. Our ICU numbers are still low now, as you heard just now, but we must not be complacent and assume this will automatically remain so over the coming weeks, because severe illness typically comes 2 weeks or more after one catches the virus. So we have to monitor the situation closely and also see and learn from the experiences in other countries. There are countries that are highly vaccinated, which have gone through a wave of infection, and they have kept their hospital system intact and avoided high death toll in their society. On the other hand, there are also countries with a highly vaccinated rate experiencing a wave of infection, and despite their best preparations, they have seen these cases, infection cases, follow through to more people needing oxygen and ICUs. Their hospital systems get overwhelmed, and eventually they see more people succumbing to the disease. Take Israel as an example. It's a highly vaccinated population. It's now going through a wave of infection. Cases have gone up sharply, and the ICU cases have also risen. And over the past week, they have seen an average of 25 deaths a day. And that's why we are asking everyone to exercise restraint during this period. Scale back your non-essential social activities, get tested regularly, and let's all do our part to try and slow down the spread of the virus. I should add that throughout this pandemic, our actions have been guided by data and evidence and based on the advice of our medical and scientific experts. And the collective view of the MTF and our experts is this. First, we do not think there is a need to return to the heightened alert and circuit breaker at this juncture. As I said on Monday, these are last resort measures and we should not rule them out entirely. In the event that we see the risk of our hospital system being overwhelmed, we may have to introduce them. But at this point, we do not see a need to return to the heightened alert or to the circuit breaker. Second, we also do not think it would be prudent to press ahead with any opening measures during this period, especially when we are in the midst of an exponential rise in infection cases. In fact, that would be a reckless thing to do under current circumstances. So thirdly, our position is we believe it is more prudent to take a pause now, do our best to slow down the spread where we can, and then monitor closely what happens to our ICU situation over the next 2 to 4 weeks. And meanwhile, we continue to take several important measures. First, as you heard just now, adjusting our healthcare protocols to cope with the surge in cases, to ensure we have sufficient capacity in our hospitals to take care of all the serious cases that may emerge in the coming days and weeks. Second, for all of us to do our part to exercise restraint and moderation and scale back on our non-essential social activities, especially for our seniors and for those who are living with seniors. Third, step up regular widespread testing with distributed test kits to every household. We are in the midst of distributing them, and we will be starting that process for employers as well. So let's all get into the habit of being tested regularly. It's a very effective way of detecting cases quickly so that we can slow down the spread of transmission in the community. And finally, we will continue with all our efforts to roll out vaccinations to those who are still unvaccinated, especially our seniors, and we will proceed with our booster program for those 60 and above quite soon. We know that this is an uncertain and difficult time for all of us, but as we have done over the past 20 months, tackling and fighting this virus, we will be able to overcome this wave of infection by continuing to work together and stand together. Thank you.
Sorry, can I just take a couple of minutes to repeat what I said just now in Chinese? Not the whole thing, just a couple of things. 我为了准备今天的讲话要点，听取了很多专家和医生的观点，他们要我向几个群体提供以下的一些重要建议。第一，如果您是年长者，尽可能在接下来的1个月里减少您的社交接触，有必要时才出门，比如去买东西或者去看医生。如果您还没有接种，就更应该减少外出。如果您出门和朋友聊天聊上1个小时，口罩没戴好，没有遮到鼻子，你被感染的风险就非常大。如果您是第二呢？如果您是比较年轻的人，但是你同住的父母或祖父祖母都是年长者，那也请你帮帮忙，保护他们。所以你也尽量减少社交接触，减少在外用餐，也不要带太多朋友回家。这些都是很有可能能够把病毒带回家，感染家里的年长者。第三，如果你正在怀孕，应该明白的是，科学数据很清楚地显示，接种疫苗对你和你的胎儿都是安全的，但是感染冠病是不安全的。 所以希望你尽快去接种。第四呢，如果你到现在还没有接种，甚至可能游说父母亲、祖父祖母或者怀孕的妻子不要去接种，现在是时候重新考虑了，赶快去接种，因为被感染的风险很明显的提高了。我们到了这个阶段，比起以前更需要大家一起努力合作，有公民意识，负起个人的责任，保护自己，也要保护我们身边的每一个人。谢谢。
Thank you. We will now invite questions from the media.
Thank you, Minister and DMS. Dear members of the media, please note that all press materials and panelist remarks are strictly embargoed until the end of the press conference. We will be announcing the exact time later for the embargo to be lifted. Please look out for the final version of the press materials, which the Ministry of Health will issue after the embargo lifts. We will now begin the Q&A segment. Please remember to use the raise hand function on Zoom if you would like to ask a question. A reminder to keep to one question only. Please also keep your questions short and sharp, as we have limited time for this Q&A segment. If you are called upon, you will be prompted to unmute yourself. Please do so accordingly. May we have the first question from Timothy of the Straits Times, please?
Thank you, Ministers and DMS. Now, I understand that the situation is evolving and we're being cautious, but I think some people are quite upset because it feels like we worked hard and hit the 80% rate, but are now being told to cut down on social activities, and there are people complaining of shifting goalposts. So could we please find out what specific number, for instance, less than 30 severe cases for 2 weeks, the task force is now looking at before deciding whether to loosen or tighten restrictions, so the members of the public can have some hope or something to work towards? Thank you.
Thanks, Timothy. We understand the concerns of this group who would like some clarity on the way forward. At the same time, we have also heard equally vocal concerns expressed about the number of cases we have now and the desire to tighten up further. So as I said, we hear all these views. We are monitoring the situation very carefully, and we will continue to consult our experts on the best way forward. We believe at this juncture, the best thing to do is to take a pause and monitor our hospital and ICU situation to make sure that they are not overwhelmed. It will take about 2 to 4 weeks because of the time lag between catching the virus and the onset of severe illness. Our key aim is to make sure that the hospital and ICU are not overwhelmed. And so we have to not only watch the numbers, which is something you asked about, but also the trajectory. Because the number may be 50 or whatever it is in a few weeks' time, but if the trajectory is going up sharply, then it is a warning sign that in the coming weeks, we may see many more ICU cases. So it is very hard to give one specific indicator because we really have to watch for the overall situation and where the trends are, and not just the level, but where the trajectory and where the trends are. But that's something we are monitoring closely. We will continue to provide timely updates to everyone so that people get a sense of our latest thinking. And if indeed the ICU situation remains stable over the next few weeks, then at some point we will be able to get back on track with our reopening plans.
Just a couple of supplementary points. I think the great majority of Singaporeans, I don't think, or great majority of people living here are not demanding that they must, be totally free to engage in social economic activities. Where required, in fact, I think our population has demonstrated a very high degree of cooperation, taking a bit of personal restraint in order for the entire situation to turn better. And I think that has been the case so far. What I think people do want is a clear plan going forward. Yeah. And I think we'll explain that right now. Imperative is to change the healthcare protocol so that we can cope with it and then observe. And next 2-3 weeks is critical. We need to observe. just on ICU, I mentioned before that we can stand up to a max of 1,000 ICUs, but really we don't want to go anywhere near that, because to reach there, you seriously degrade hospital services. Yeah, right now we can probably stand up to a couple hundred, 300 maybe, and able to cope with that level. So this is the kind of cap that we are working on for the time being. As Minister Lawrence said, it's very hard. I think there is a desire to see what is the criteria crossing of which we know something will change. It's hard to pinpoint that level. We do need to look at the trajectory. It's more important. And if the trajectory doesn't look good, we have to do something. If it's well within what we can sustain, then I think there's no need to throttle back. So next 2-3 weeks, let's observe, is critical.
Thank you, ministers. Can we have the next question from Zhi Peng of Zhao Bao?
Hi, good afternoon, ministers and DMS. In yesterday's MOH press release, one of the new active clusters being closely monitored by MOH is the Huli Impacts, which is a distributor for fresh produce. May we know if it is linked to the wholesale vegetable night market at Toa Payoh East, which has voluntarily closed for 2 weeks after several cases were detected there? And could this potentially expand into another large cluster involving market vendors, like what happened to the Jurong Fishery Port cluster? Thank you.
Thank you very much for the question. We are continuing to look very closely at this particular cluster. This emerged yesterday, and we are still in the midst of epidemiological investigations at this point in time. So activity to identify close contacts, quarantine them, test them is still ongoing. We have not been able to identify any definite links with other clusters, other places, including the wholesale sort of situation that was also reported in the newspapers today, or other markets, but we are mindful of always that possibility, and we'll be looking at the phylogenetic test results later on to determine whether there is indeed a link with any other cluster existing currently in Singapore. We will be working closely with the sector lead, which is SFA, the food agency, on the requisite measures to ensure that safe management measures are taken in this particular setting and complied with, and we will work with them very closely to ensure that the food supply is not disrupted as a result of these clusters.
Thank you, DMS. Can we have the next question from Chin Sen of Today?
Hi, ministers and DMS. The question is really about, I know you said that we probably be able to cope with 100 to 300 cases in the ICU, and we can cope up to 1,000, but we are not even close to that level yet. So I guess the question is, are we at the point where we should ask ourselves how many serious illnesses per day or deaths per day from COVID-19 is acceptable before much tighter measures have to kick in? And is there a way that we as a society can come to an agreement on what this figure is, this morbidity figure is? Thank you.
Yeah, I mentioned 1,000. As I said earlier, 1,000 is what we can possibly stand up, but we really don't want to go there because it will degrade our hospital services, and it's a contingency plan that we hope remains in the drawer. Yeah, what we can almost very quickly do is to ramp up to close to 300, and that is the capacity we can handle from a capacity point of view, not from the point of view that we are setting a target for 300 ICU. What can society and ourselves accept at what level of ICU and morbidity? I think it's something we will have to watch, observe, and we hope that this is as low as we can. We are in a very delicate balance of lives and livelihoods. Yeah, I think that is a discussion, a social discussion that is ongoing. I don't think it is possible for us to now set a target for morbidity. Yeah.
Can I also make the point, just to supplement what Minister Ong said just now, that one should not underestimate exponential growth. Don't be lulled by a 7 case in ICU and therefore we got so much headroom. Exponential growth can change the situation in a few weeks' time. And that's why our main concern now is not even talking about steady state, what kind of mortality rates for the whole year. That's a separate conversation which we can have later on. And indeed, once we start living with COVID, we must, as we have always said, expect more cases, more deaths from COVID. Yes, in steady state that will happen, but we are now focusing on being in the midst of an exponential wave of cases, which will rise very rapidly in terms of the infection numbers in the community, but we don't know yet what will be the impact on our hospital system. And that's why we are just asking for a pause over the next 2 to 4 weeks so that we can look at the data, understand the patterns of transmission and how it might very well follow through to severity and severe illnesses, make sure that our hospital system can cope before we decide on what the next moves might be.
To add on a few additional points to both Ministers Wong and Ong, we are in a very unique situation in Singapore. We've had a very high vaccine coverage rate, which is enviable among many other countries who have not been able to achieve as much of our high coverage as we have. But we are also in a very different ballpark compared to countries like the UK and Israel, who have had to battle before they got high vaccination coverage rates with high community numbers of infections. And therefore, if you call it that herd exposure to COVID-19 is very different from us as it is for those other countries. And because there are very few countries before us who have taken the steps that we have taken, there are very few precedents that we can look at to give us the confidence of knowing where our trajectory is going. If we look at the UK, we can see clear evidence that despite their opening up with their Freedom Day, an increase in numbers of community cases in the population, it hasn't translated to the same commensurate increase in the number of people being hospitalized, the number of people being admitted into the ICU, or the number of deaths. However, when we look at the situation in Israel, that association or correlation is not so clear. They have seen some increase in ICU cases, and they have also seen increases in the number of deaths, which may also explain why our counterparts in Israel are very concerned about needing to implement the booster vaccination program very early. I'm mindful that the numbers report now in the ICU, low as they are, reflect a situation that's consistent with the infections that occurred 1 to 2 weeks earlier, because there's a lag phase between people getting infected and then deteriorating to the extent they require ICU care or even then subsequently dying. So our numbers now in the ICU may be correlated with the number of cases we had 2 weeks earlier when the numbers reported were still relatively low. So we need to look over the next 2 weeks to see whether with each succeeding week, the numbers in ICU now start to rise. And if they rise with a similar trajectory as what we're seeing in the total number of cases, this raises causes for concern. And it may be that we then need to think about additional measures that need to be taken to damper down on transmission that takes place in the community. But if we continue with the situation as we are now, despite the number of cases increasing, but the number of cases in the ICU either being relatively stable or with a very slow increase, not consistent with what we see in the total numbers, it creates greater confidence that the resources we have in the hospital and our healthcare system are able to cope with the situation at hand. And that would be then the recommendation we give to the multi-ministry task force that it may be appropriate then to press on with our transition then to a COVID-resilient nation.
Thank you, Ministers and DMS. Could we have the next question from Sing Hui of SEMP, please?
Hello, hi, good afternoon, Ministers. Earlier on, you said that with this, 1,000 COVID-19 ICU capacity, and that we are also asking hospitals to bring their reserves bed on in case you need more ICU beds, right? So all in, really, what is the number that we have?
Sorry, what do you mean?
What is the full ICU capacity that we have I think earlier on,
What we mentioned, there was many press conferences ago, there was a figure of 1,000. But as I mentioned, this involves severe degradation of hospital capacity. So we don't really want to get there. At that time, I also say that we don't want to get anywhere near there. Yeah. But what we can cope with now is we can ramp up to close to 300 quite readily. And that will be the capacity that we are working with now.
So to clarify, the 1,000 beds will include converting some of the existing beds and deferring some of the electives so that we can then focus our hospital resources to deal with the COVID-19 cases. So the 1,000 beds already included the other hospital beds that will need to be converted.
Thank you, ministers. Can we have the next question from Geraldine of CNA?
Hi, ministers and DMS. So I'd like to ask, earlier in the press conference, it was mentioned that we will be prioritizing contact tracing resources, which means that not all cases will be interviewed given the time that it takes. Is there a concern that it might take longer to detect and ring-fence cases if, for example, the new variant that's been detected that is known or considered to be more contagious and resistant to vaccination is somehow makes its way to Singapore?
Thank you very much for the question, Geraldine. We should perhaps start by stating that we are not giving up on doing contact tracing. Contact tracing still continues. We still endeavor to understand modes of transmission and to control transmission that takes place in the community. But we've come to realize that in the contact tracing processes, protocols that we have done so far, we do need to improve our processes to ensure that we can identify those who are truly at risk of getting infected and those who have been infected and potentially are spreading the community. We want to be more focused on making sure that we can identify them quickly and therefore have more targeted focus efforts in identifying these groups of people. Therefore, contact tracing is not stopping. We're not saying that contact tracing is no longer important, but we are reprioritizing the way in which we do things in a more targeted and focused way that allows us to then be able to identify the important chains of transmission that are necessary to disrupt these clusters from forming, particularly where there are vulnerable members of population there. And that includes the vulnerable seniors that we have in hospitals and healthcare settings, in nursing homes, in our schools, where children still are not vaccinated. So we want to be a lot more targeted, a lot more efficient, a lot more able to then identify the at-risk people and bring them to a testing or isolation protocol as quickly as is possible without wasting additional resources looking at other people. So we no longer need to draw very large rings or bringing too many people under quarantine, but we want to be a lot more targeted in our approach.
Thank you, DMS. We will now take the last few questions. Can we have Shi Xuan from Channel 8 News, please?
Hello, good afternoon, Minister and DMS. So in September alone, we have more than 100, actually about 200 cases of individual under 18 years old who are infected. So based on that figures, the majority of this group are below 12 years old, which means they are unvaccinated. So parents are rather concerned. So my question would be, what would be government's next step or what measures will be taken in school setting where most of these children are unvaccinated? Can we also request a Chinese soundbite for this as well? Thank you.
Okay, I'm being highlighted. Speaking as a former Minister for Education, the schools have some of the most effective measures to contain and prevent transmission. And so if you look at the past 18 months, we managed to keep schools open throughout that period. And we had one school who had transmission. And that's actually really the work of parents, students, teachers, principals coming together to make sure those measures work. So it involves several levels, One is within the school, students are cohorted, and that is extremely important because if you are confined to interacting within your class and within class, your own group, you don't cross, in fact, other classes or even other schools. And when it comes to quarantine, it becomes easy. So that is quite critical, number one. Number two is actually a very strict entry policy into schools. So of course, it's not just that if you're sick, you can't come to school. If someone at home is sick or someone is infected or quarantined, we also implement a leave of absence policy. So that preempted viruses from coming into school. And third is, of course, the students are all taught a much higher level of personal hygiene. I believe they are still cleaning up after themselves in the canteen. And so all three work well together. But of course, now we are at a different level with much higher infections and with Delta variant. So one additional strategy is testing. The MOE is still working out the details. I think it's better we let them explain it, and I think they have put out some information. Testing will allow us some sense and surveillance of whether clusters are forming in schools. And then MOH will do the necessary to support MOE to contain, quarantine, trace, test, and contain those clusters. So it is 四管齐下, many approaches together. Oh, you wanted Chinese? Sorry. Maybe I should have just, okay. 这过去18个月，学校没有关闭，所以在全世界呢，新加坡在这方面呢，我觉得还很欣慰，学生没有因为冠病的关系而失去他们教育的这个机会。这都是家长、学生、老师、校长大家一起做出来的功劳了。大家一起配合，我们有好几个措施都是相当有效的。第一就是在学校里，学生都是有组成自己的这个社交圈，社交圈不会说跨级别或者跨班级。所以这样的话，如果说有谁被感染的话，这个感染圈就是越来越小，就是最小的，可能就是最小的可能。第二就是学生也在学校的教导下，培养了比较好的这个个人卫生洗手不动自己的脸，口罩戴好。食堂休息过后，现在还是学生自己会抹桌子，保持干净。保持卫生。第三就是很有效的一点，就是进校的这个措施，安全措施也是很有效。就是说，不只是说一个学生如果生病不能进学校上课，家里有人生病，家里有人被隔离，学生也不能够进学校。这样呢，就防止这个病毒侵入学校。但是现在当然情况不一样，德尔塔病毒传染率比较高，也比现在病例也多了很多，所以我们要有新的措施。这个新的措施就是检测，这个教育部会逐步的公布详情。通过检测，我们就能够更快的能够观察到哪一间学校哪一个班可能会有病毒的感染，然后采取很快的行动。有一点我们也要欣慰的就是过去18个月了，300多个学生，300多个小孩被感染了。很幸运的就是我们在新加坡300多个学生，每一个都是没有病状或者都是轻微的病状，没有一个学生有严重的病状。所以在这方面呢，学生的抵抗力还是比我们成人来得强。这是我们也是幸运的，但是也不可以松懈。要继续的保持学校的安全。
Thank you, Minister. Can we have the next question from Chen Ling of Reuters, please?
Hi, Ministers. I would like to clarify on that point on cutting the quarantine days to 10 days. So does that apply to all close contacts of the COVID-19 patients and their family members? And also, does it include those travelers from overseas? Yeah, thank you.
Yes, to all the people you mentioned, but not travelers. I think travelers coming from different countries, I think we want to take a while we want to be a bit more cautious, and we keep SHN to 14 days.
Thank you, Minister. Can we have the next question from Jolene or Xingmin, please?
Hello, ministers. Can you hear me?
Yes, we can.
Okay, sorry. Hello, ministers and DMS. May I just ask regarding the Huli impacts cluster, are there any initial indication at all that the virus are transmitted through having meals together, just like the bus interchanges? And also, since the threat of workplace transmission is very real, and there's been a lot of transmission in the workplaces going on already, how do we ensure that workplace gathering doesn't actually happen, because it is in a private setting, which is not that easy to detect?
Thank you very much for the question. We are looking at the possibility that spread has occurred in the workplace through mask-off interactions between workers at the workplace itself. Whether it's in the context of having rest periods, whether it's in the context of having meals, or whether or not there were breaches in safe management measures, they were taking off masks while they're at work, is something that needs to be clarified, and investigations are still ongoing. You do raise an important issue that there needs to be compliance with many of these safe management measures. They are important and critical to prevent transmission of COVID-19 infection in the workplace. But this responsibility for ensuring that these measures are undertaken has to be at several levels. First of all, it has been an individual's responsibility. Every one of us in our own individual workplaces needs to be responsible to make sure that we don't expose ourselves to the risk of getting infected, but also we don't participate in any activity that leads to transmission, spread of infection occurring from one person to another within the workplace. That's a personal responsibility, it's our own social responsibility, and it protects our families against the risk that we will get infected and bring that infection home, where we may have other vulnerable loved ones at home. It is also the responsibility of the employers and those who are responsible for activities being conducted at the workplace itself to ensure that the workplace is a safe one, and from a safety perspective, it must include attention towards making sure that infections don't occur and don't spread. We at the government and public service level will put in place guidelines, a framework, and advise and help the employers to institute the correct measures to take place. But that first responsibility has to be at the level of individual persons, employees, staff, and also at the level of the employers and companies.
Thank you.
What Kenneth mentioned is an extremely important point. Government will still do whatever we can in ramping up our healthcare facilities, contact tracing wherever we can, doing tests, facilitating all this, taking care of patients, linking cases wherever we can. We'll do all this and vaccinating as many people as we can, but we are in a phase where we have to really work together as a society, between people and government. So employers, individuals, families have to all do their part, exercise that social responsibility. It is, as you say, many of these are in private space. It's not possible for government to go into all the spaces.
I just wanted to add one point on testing, that we are very concerned about workplace transmission, and that's why we announced recently that we want to expand testing in workplaces, quite aside from safe management measures, which requires everyone to do their part to comply with. So you know that we have increased the frequency of regular testing from once a fortnight to once a week in high-risk settings. Number two, we are expanding the definitions of high-risk settings so that it covers more sectors: retail, transport, delivery personnel. And these are all mandated testing, so it will be once a week. But beyond that, there will be many other workplaces that are not in that, even in that expanded mandatory high-risk group. And for all employers, we are encouraging, in fact, we want everyone to test regularly your on-site workers once a week, and we will be distributing test kits to employers to enable such regular testing. The public sector will be doing that, so all public servants who are working on-site will be getting test kits to be tested once a week, and likewise, every employer will be getting these test kits and should put in place a regime to test their on-site workers once a week. If employers and individuals, all of us do our part for such regular testing, it will definitely help to slow down the spread of the virus.
Thank you, ministers. Can we have the final question from Hui Min of CNA Digital?
Thanks for taking my question. So I wanted to ask, what's the task force's sense of how ready the public is to deal with the very uncertain next 2 to 4 weeks, especially after, I think a lot of people saw the lifting of the phase 2 heightened alert measures as kind of a light at the end of the tunnel. So how confident is the task force that people will voluntarily change their behavior to help reduce the spread when there's already a very high level of COVID-19 fatigue? Thank you.
We understand that there is fatigue, but I think people at the same time are also concerned about their health and the safety of themselves and their loved ones and family members. And that's why we are not making a return to the heightened alert, because if there is tremendous fatigue, and we have said that our focus is not the daily numbers, but we're looking at the hospital system, and therefore, with a high vaccination rate, there is no need to go back at this time to a heightened alert. But what we are seeking everyone's cooperation to do is, number one, be responsible and do your part to comply with prevailing safe management measures. All the sensible precautions, which includes wearing the mask properly, keeping to the group sizes, which are the current rules, and then maintaining safe distance from different groups. Comply with that. And number two, start a new habit of regular pervasive testing, which is what we are now trying to get people used to. And it's really in the interest of all of us to do that. For employers, for companies, if you get your staff and workers tested regularly, then you are able to pick up cases faster, and you can reduce the chances of having your whole business, your whole enterprise being shut because there's a large cluster that emerges later. And that can be avoided if you have a system of regular testing and you are able to pick up an infected person much faster. Likewise, for individuals, if we all start to test regularly, then we know if we are inadvertently, we may be asymptomatic carriers. And before we visit our parents, before we visit loved ones, before we go out to interact with others, if we know that we have we happen to be carrying the virus, then we self-isolate and we avoid spreading the virus to our family members. So really, it's in all our interests to start this new habit of being tested regularly. And we call on everyone. Number one, comply with safe management measures. Number two, get tested regularly. And if we do both of these things well, we will be able to try and slow down the spread of the virus and get through this wave of infection with as low a death rate as possible.
Maybe one short point just to supplement. On the government's part, we must have a clear plan and explain it to people, including being honest when things doesn't go as anticipated, and what are the possibilities. And I think government has to do that. As for the people's part, there will always be different views, different expectations, but at the end of the day, over and over again, the people of Singapore always demonstrate that we will rise to the challenge.
Let me maybe round up. I think the MTF does not take the support of Singaporeans for granted. I think we are very appreciative that we have been able to come so far because of the trust between the people and the government, and because of the support that people have for our various measures. Some of the measures can be very difficult and challenging, but they comply with them. So we fully understand sometimes the frustration that we are not able to open up as fast as we would like to. But it's also important to bear in mind of the situation that we are in today, that we are in the midst of a new wave. And over the last couple of weeks, we have seen our number of cases doubling every week. And what is important for us is to keep our eyes on the number of serious cases, ICU cases, and mortality, deaths, and to make sure that they don't rise rapidly. If the number of deaths and ICU cases also double every week, I think in time to come, we will have a problem with our healthcare capacity. If we are able to keep the number of deaths and ICU cases well under control, despite rising number of cases, then we will be able to continue our opening journey more confidently. In the meantime, we do what we can to slow down the doubling of this number of cases so that we have more space to monitor and to adjust our healthcare measures and healthcare system. And we will do some tweaks like making our workplaces safer, increase our testing in our workplaces to allow us to be able to slow down the transmission and give us more space and give us time to monitor whether or not our serious cases and mortality will be under control or it will double. So this is something that we have to continue to monitor. And once we are able to keep the serious cases and mortality under control, I think we will be more confident in opening up further. So thank you very much.
Thank you, ministers and DMS, for your time. Thank you, everyone, for joining us today. We have come to the end of the press conference.